everyone, and welcome to DE Business Lab. I'm Dr. Pam Maragliano-Muniz, Chief Editor for Dental Economics Magazine. With me, by popular demand, is Kendra Sellers from Tips Medical Billing. Kendra, welcome.
Thank you. Thank you for having me again.
I'm so happy to have you back. It's so good to see you. And we have such a cool topic we're talking about. I think it's almost like one of those topics that nobody really talks about that much, unless like something really weird turns up. Dental emergencies. I feel like it's something that comes up all the time, whether it's small or big. And there are opportunities for us to actually make money from a dental emergency and actually be reimbursed properly. So, Kendra, tell us how that works.
So what I often see when I often am doing medical billing analyses, and I see so often undocumented, untouched opportunities, and emergencies is one of them. Even right down to consultations as well. When we even look at just the exam and evaluation portion of anything we do. It's an untapped opportunity to be reimbursed. And I think our mindset is that dental doesn't pay for that exam or that consultation, so we don't charge for it. But I don't know about you, but every time I go to the doctor, I get charged for my evaluation. So it's not, we just have this limiting belief about that. And half the battle is just changing our mindset about what we can get reimbursed for and what we should get reimbursed for. In situations like emergencies, they disrupt our schedule. We have to squeeze them in. We're doing same day surgery. We are a mini OR every day, all day, and we're not reimbursed as such. So it's one of the things that I talk with my clients about, and when I'm doing a medical billing analysis all the time about untapped opportunity. Because at the end of the day, we have a lot of supplies and equipment to pay for and staffing. So how do we do that?
And it's one of those procedures and one of those scenarios where we could be saving somebody's life, and it's funny that you'll see somebody and sometimes they have a big infection or something like that. And we're a significant part of their healing. And sometimes we'll take care of it and just send them on their way, and sometimes not even be compensated for it. Not that, we're looking to, I don't mean it from a good greedy perspective, but we should be compensated for our time. And there are opportunities to compensate ourselves via medical billing. So can you tell us about some procedures that we could bill medical for?
Sure. So so often does this happen to you where you have an emergency where a patient has an abscess tooth? Is that a weekly occurrence in your practice? Is it, I hear from practices, oh, we see that all the time, but what does that really mean? I don't know how often that happens for you, but I would say in most practices, it's probably once a week.
I would say that's reasonable.
I think that's really reasonable. I always like to look at the low end of the hanging fruit, and not get this, $1 million promised land for you, but like what's really doable and what's happening? What are the opportunities for that? And I think it's important for us to remember, I think we're so used to seeing pain and infection that once we don't document it well, it's just part of our everyday life. Again, because we are a truly an urgent care in some regards for situations like this. But we don't look at ourselves that way because we're so used to seeing it. Like we're so used to seeing periodontal disease. But I don't know, abscess teeth are a huge opportunity. It's an infection. And as you said, the risk of complications systemically is huge. If you follow Bale Doneen, Dr. Bradley Bale or Amy Doneen, and the heart attack gene and the studies that they've done, we know that 50% of heart attacks and strokes are caused by an oral infection, whether that's an abscess tooth or a periodontal disease. And guess what? That abscess is really close to the brain. it makes complete sense. And I was watching or not watching, but I was reading an article in DE, and I hadn't thought of this either, about how they call it facial infection, how that is actually, it could close the airway. I hadn't even thought of that. I don't know why I hadn't thought of that. I just hadn't thought of it. I think about the brain, but I wasn't thinking about the airway. And I thought, wow, that's really critical. And often these patients do go to the ER and not to us. And the ER sends them on their way, and they didn't come to us in the first place because they didn't know how they were going to pay for our services. So we need to give them the opportunity to bill to their medical so that they can get the help that they need, because patients are dying every day from oral infections.
So what's interesting is, I mean, at least in dental, if we see a patient, say we're trying to get reimbursement from a third-party payer, we will get reimbursed for the exam or the therapy. There's no, like, you can't really do both. But with medical billing, you can be reimbursed for your diagnosis, your exam, and obviously any intervention that you provide. So there's a greater opportunity and a more appropriate opportunity for being reimbursed.
Yeah, so let's break it down. There's the evaluation. It's especially in these situations, they're typically an emergency, and an emergency is considered 72 hours of onset of pain or trauma, infection, whatever, 72 hours of onset. So that in itself, even if we were to bill it out as dental, for starters, we end up with that limitation of how many exams we can perform with dental benefits, as well as how much we get reimbursed for that benefit. In medical, you could easily, for a same day surgery, easily get paid in the $200 range. I mean, conservatively. Because in medical, we're paid for evaluation and management based on the time that we spend with the patient and the complexity of the situation and how hard we have to think and what we're having to do. Obviously, a same day surgery, we are evaluating, treating, and doing surgery. So they pay very well for that. So there's that. Typically, we do a PA, we have an abnormal radiographic finding, we move to a 3D, because if we're going to do surgery, we want to have that 3D to see how big is that abscess or that lesion that we're looking at to remove. If we're not doing that, we're doing ourselves a disservice, really, because we could be getting into uncharted territory that we don't know. What if it has sinus communication? What if it is close to the mandibular nerve? Those are all reasons why we would take a CT to identify and prep for the surgical procedure. So the CT, you can also do a cyst removal. And in dental, I believe that's attached to the extraction. So in medical, it's not. And in fact, medical doesn't want to pay you for the extraction. They don't care about the tooth. What they care about is the infection in the jawbone. So the cyst removal is a surgical procedure. You're curetaging that infection and that osteomyelitis out of the bone. And now you have a bony defect and it needs bone grafting. So that's another billable, payable service. And these are all things that are basic treatment for that encounter. But what I often encounter is people are billing out an evaluation, or not an evaluation, they're billing out the extraction, and that's it. Because all of the other stuff, dental doesn't reimburse. And we're afraid to ask our patients to pay for that. It doesn't really make sense. And I get it. Again, I say this all the time because as a hygienist, our patients are like family to us, but we're doing a surgical procedure and we should be reimbursed for that. And I feel it's one of the biggest untapped opportunities in a dental practice, because it happens, even if it happens once a month, twice a month, I would bet that it happens almost once a week in every dental practice. And if you look at that reimbursement, I was just calculating like minimum of what that could look like. Usually it's about $2,300. And if that happens 4 times a month, That's that's $9,000. And if you look at that for a whole year, you're at $100,000 in lost revenue for one encounter in your practice.
That's significant. Now, let's be real. It's not as straightforward, or it's not as intuitive as we just know like CDT codes and how to, submit for dental billing, and medical billing's not the same. So can you walk us through, the process, but also obviously as for us as dentists, we would need somebody like you to kind of help facilitate this or help get us going as we start considering medical billing.
Right. And that's actually our niche at TIPS, is really getting this implemented and having somebody to walk in tandem with you so that you get everything right the first time. Because I often do have practices that have tried this and not been successful at it, or, everybody learns different. Everybody needs different guidance, and right down to reading the EOBs. I get this all the time, oh, they denied it. And it's like, no, they didn't deny it. They just need more supporting documentation. They just, just like dental. So there's a lot of similarities with medical billing as dental, but it's a different code set. And we actually have to have diagnosis codes that speak to why we're doing the procedures that we're doing. It's really not that hard. There aren't that many codes. They're pretty common. And this is an encounter that happens over and over and over again in our practices. So you just repeat. It's not that tricky, but having somebody to help you and your team and be coached through it and help you guide every direction, every encounter that could happen or every hiccup that might happen. That's what we do, because my goal is for you to be successful and for you to increase production while providing an amazing service to your patients too. Because I think we've dropped the ball a little bit on the value that we place in ourselves as oral physicians and what we really do, what we provide, and the significance that we play in our patients' overall health is super important. And this is one topic that, you hear all these stats about emergency visits for toothaches, and they are not able to treat them. I don't know. I'm always baffled by the whole process. The longer I do medical billing, it's an untapped revenue source for sure in our practices. And I would love to see more practices being able to offer that to their patients and getting patients into them, going to your urgent cares, going to your, emergency rooms and saying, hey, we can bill to medical, send those patients to us so that we can get them the help that they need. Because patients really, they don't connect the dots between dental and medical either. There's a gap in our profession. There's a gap in our consumers in what we do and how we can help.
That's really great. And that's really interesting to make yourself a resource to our medical colleagues, to have the patients sent our way so we can certainly get them the help that they need, probably give them a diagnosis much quicker, and also get them the care that they need a lot faster as well. So, I mean, gosh, we're talking about a scenario that's so common that we see all the time. And so to be able to be reimbursed, what we deserve, what we're worth, I think would be absolutely incredible. And I'm sure a lot of people will feel the same way. So Kendra, can you tell me how we can reach you and where can we get more information?
Sure. You can reach out to me via my website, which is tipsmedicalbilling.com. Or if you want to reach me directly, you can send an email to me at Kandra@tipsmedicalbilling.com. And my name is spelled Kandra at medicalbilling.com. I would love to hear from you. Typically, I set up a medical billing analysis and we talk about the scenarios and the opportunities I see. That being said, I know I throw out some numbers. Those numbers have to feel right for you and what you feel comfortable charging for your patient. I met with my accountant yesterday and he's like, there's pigs and there's hogs. don't be the hog. I'm like, okay, that's a great scenario. Like, do what's comfortable for you and what you feel like your value is in this process of how do we come up with fees. Yes, now medical has a huge reimbursement opportunity. We've talked about that, and I wrote about that in April in the DE magazine. Medical reimburses anywhere between 2 and 12 times higher than dental. So those are the things that I put out there. It's always up to you to decide what you feel it's worth to you and what you want to tap into. And I don't ever change fees right off the bat, but even this morning talking to a client, they recognize that their bone grafts at $500 are being reimbursed 100% every single time. Well, their fee is too low. I mean, medical would pay $1,500 up to $9,000 for a bone graft. So it's a different opportunity, and we just have to shift our mind to understand it a little bit differently. But it's well worth the investment and time to learn it, because I think we're going to continue to see more of a push towards medical billing.
I think so too. The more and more, and I feel like it's so evident that oral systemic health is a thing. And so I think that we need to partner with our medical colleagues and in our way being able to benefit from the insurance that patients already have. It's just us learning how to bill for it. And so I think that is certainly something that has given a lot of us something to think about. So Kendra, thank you so much for your time. And thank you so much for bringing up this really important topic.
Great. Thank you. I look forward to hearing from you all.
Thank you. All right. For DE Business Lab, I'm Pam Maragliano Muniz, and I'll see you next time.